This is Mark Chris from Memorial Sloan Kettering, commenting today on the annual release of the article by Dr. Siegel with the cancer statistics for 2022. And there is a lot of good news in the lung cancer area. I think first and foremost, lung cancer mortality has decreased by 10% over the last 15 years, an amazing statistic. The incidence of lung cancer has fallen yearly by about 3% in men and 1% in women. And more cancers, when they're discovered, are localized, giving us more options for treatment and more chance for cure. So that's a lot of good news in that article. There's also some other news, though, that's worth commenting on. And the first is that for the very first time, the number of persons with lung cancer diagnosed this year is greater in women than in men. This is the first time this has happened. And what it reflects is a prior history of smoking among women. As you know, the number of women and men smoking is nearly equal. The number of men and women starting smoking is equal. And as that has happened now, the number of cases of lung cancer has become equal and now even favor women. It reflects smoking that was done a long time ago, and it's just a observation that lung cancer is becoming an even more important illness among women. The good news among women is they do live longer. There are fewer deaths among women than with men, even though the incidence is higher, but it's still a statistic that reflects prior smoking. A couple words about it. Smoking is the leading cause. It's smoking many years ago. Most people that have lung cancer diagnosed now have stopped smoking many years ago, but the damage lingers there. What can be done about it? Well, first, do everything you can to facilitate smoking cessation. Do anything possible to get people not to start, and whatever influence you have to get people to stop, and use all the resources that you have. The other interesting paper that came out in 2021 was by Dr. Sheikh in the Annals of Internal Medicine, is that even among people that have had lung cancer diagnosed, stage 1 to 3 lung cancer, if you get them to stop smoking, their survival improves by almost 2 years just by stopping smoking, adjusted stage for stage, and their progression-free survival, and that the chance of cure goes up by 10% if you stop smoking while you have your definitive therapy, your surgery. Those are amazing numbers. They generally exceed the kind of benefit we see from at least adjuvant chemotherapy, and stopping smoking is important even when lung cancer is diagnosed. There's other data out there too that cancer therapy is much better tolerated if you stop smoking. So even if you have lung cancer already, stopping smoking is a lifesaver and makes therapy better. The other thing that remains a huge issue in the US is the lack of adoption of screening for appropriate people. Last year, the US Preventative Services Task Force modified the recommendations for lung cancer screening. They recommended screening for lung cancer for patients that had a 20-pack year smoking history between the ages of 50 and 80, and either continued to smoke or stopped less than 15 years ago. They broadened their statistics somewhat. Even with that, a minority of people that are eligible for screening, even using those strict criteria, are not screened. So please, wherever you have the opportunity to screen patients, whenever you have the opportunity to recommend screening to other physician groups and community groups, please do that. It's safe, it's cheap, and it clearly saves lives. We have the chance to further decrease lung cancer mortality by facilitating screening. So lots of good news there, but I urge you all to roll up our sleeves. Let's use the therapies we have to help people cure lung cancer and live longer with the illness, live more normal lives with the illness, and also try to prevent lung cancer through smoking cessation.